So now I'm just going to show you what we just talked about, and I'm going to show you briefly. So on the stretches, you're going to have the elbow extended and the wrist is going to go down into flexion. And the stretch is going to be felt in the extensors. To increase the stretch, you are going to use counter pressure. When we look at the exercise routine, and we have stages 1, stages 2, and stages 3, stages 1 is going to be with the elbow bent and supported. Now obviously for demonstrations today, I'm supporting it with my other arm. You're going to support it as I discussed. And you're going to start with no weight and performing your 10 reps if able to accomplish initially. And the key with this is to start out in extension and go down into flexion and then slowly come up into extension. You don't want to be doing the fast motions, and that's something you must stress to your patients, especially if they're going to be doing this on a home program. So it's a controlled, slow motion, and that's going to build up the muscles and what the muscles can tolerate, the demand that they can tolerate. And as you improve, you're going to go out to stage 2, where now the arm is still supported, not locked, but it is elbow is extended. Again, starting with no weight, and start out with it going up to 10 to 15 reps, up to 3 sets. When you do the sets, the one thing I want to stress is you're going to do 1, 2, 3, 4, all the way up to 10. Then you'll turn your arm over, whatever consecutive format you want. If you're doing extension or flexion first or second, then you're going to do the flexors and then the rotation. Okay, that would be considered one set. What you don't want to do is 10, rest a couple seconds, 10, rest a couple seconds, and 10, and do 30 reps, or 60 if you're doing 20, all consecutively. So you're going to do 10 wrist extension, 10 wrist flexion, 10 wrist supination, pronation. That would be considered one set. Then you'll go on to the 2-pound weight and then the 3-pound set weight. So when you've accomplished 3-pound weights, performing up to 15 to 20 reps of each exercise of each, then you will then progress to stage 3, which is going to be arm out in front of you, locked, and then again starting with no weight, performing the wrist exercises and then supination and pronation, and then work your way up to that 3 to 4 pound weight. And then by the time you're finished, or your patient has finished this with 3 to 4 pound weight, you can then try some of the other more demanding exercises like plyometrics and stuff that we'll discuss shortly. So as we conclude with our exercises, we're going to say that exercises are critical for the flexibility and for the strength that was required for the damaged structures, for endurance, which is very critical. We want to be able to be at a normal or functional level. So by the time you get to your stage 3, you should be at that normal or functional level. You should be able to return to sports or high demand occupation activity, which is usually safe at this point. Your muscles should be able to tolerate increased weight and demand without increasing the pain. Don't forget your proximal muscles though. Now, what I want to say here is beware of information overload. So we just did talk about all of the protocols. If somebody's coming in for a 1 to 3 visit home exercise program, I am not going to overload them with having them also incorporate their upper body exercises. Now, if maybe if they actually do come in for that 3rd visit, then I probably will add that. But as we get into talking about proximal strengthening and core exercises and ergonomic considerations, and they're going to be overloaded, and they're not going to remember half of the stuff you said.